Yes, please come in, Ryan. Take a seat.
Hello, Tim. You want to speak with me?
Yes, I want to speak with you. Yes, thanks for coming by. Please come and take a seat. Like I said,
Thank you. Will this be taking long? Because I have a bunch of charting still to do since it was such a hectic day today on the floor.
no, it'll only take a few minutes.
Okay, sounds good. Let's get started then.
Sure. Well, there was a recent situation that occurred in which you were involved.
Mhm.
This situation was particularly in regards to a situation that occurred in which a patient's level of safety was not handled properly.
Okay.
This occurrence happened the other day when you helped Mr. Smith to the bathroom and left him on the toilet unsupervised to work on your chart. As you know, Mr. Smith has been diagnosed with dementia and is quite forgetful at times. So by leaving him unsupervised, you were not placing his priorities first, which led him to attempt to get up from the toilet on his own, to which then he fell and now has a broken right hip. First off, from you, I would like to obtain both your written and verbal transcription of the event. So please, in your own words, tell me what happened.
Well, Mr. Smith was requesting pain medication for his back, and while I was administering this to him, he stated, "I have to use the bathroom," which I know he moves fast and fairly well with little assist. So I assisted him to the bathroom, to which he seemingly accomplished it with minimal assistance on my behalf. As I helped him onto the toilet, he stated, "This may take a few minutes," so I said I would be right back. I went looking for Miss Aid, our floor nurse aide, to stay with him until I got back, but she was on break at the time. So I made a judgment call and figured I could get a few minutes of charting done to get caught up with my work for the day. I must have gone up with my charting as I heard Miss Aid calling for me in Mr. Smith's room. I immediately went to his room to find him on the bathroom floor complaining of pain to his right hip. I had Miss Aid obtain the diamap as I stayed with Mr. Smith to assess him for any further injuries. He appeared very stable and had a few small cuts on his right hand and arm. We then obtained further assistance from a few other nurses to help Mr. Smith to his bed, and where we laid him supine and stabilized his right leg and hip. I then called Dr. Jones and obtained an order for a chest x-ray, as an ordered for a stronger pain medication.
Okay. Well, I appreciate both your honesty and that you acknowledge your responsibility for the situation. It does seem to me that you understand where you are at fault in this. So, do you?
Yes, I guess I do. I know I should have placed my patient's needs above my own needs.
Mhm. Okay. When you say patient needs, what patient needs might that be?
Well, first off, sir, I need to understand the whole situation. I need to recognize the possibilities that could arise with each of my patients in their current conditions and diagnosis. I should have, for Mr. Smith, realized that even though he did not walk predominantly on his own, I should have recognized his difficulty getting up on his own. I should not have justified leaving him alone due to the fact of his walking ability and that moment in time. Also, I should have asked help from another nurse to keep an eye on him while I charted, if possible. Lastly, I should recognize that if I choose to do an act like take Mr. Smith to the bathroom, it is my responsibility to fully follow through with the situation. I cannot just start something and then after the plan because it gets in the way of my plans and my needs.
Okay. Well, thank you, Ryan, for your open acknowledgement of the situation. Your words definitely speak of responsibility and personal growth, and I'm happy to hear such words spoken from you. But just as in life in general, actions speak louder than words. And the actions that you take from here on out can either make this occurrence define you, or you can use it to define how you want to approach your personal career here, with the development of a proper mental fortitude. Do you understand what I'm getting at here?
Sure. This occurrence as a learning experience, not to let it define me, and to grow from it to make myself a better and more suitable nurse.
Yes, exactly. Occurrences and accidents do happen. It's part of the nursing profession. The main goal, though, is to create an atmosphere where we can decrease the probability of certain instances like this from happening. Since this has occurred, I have looked into the proper ways to make this scenario at least less likely to occur on this unit. There are a few avenues that I am going for, but I believe teaching will provide the most optimal benefit, not only for yourself as a nurse, but also with the rest of the staff on this unit. This teaching will be broached in our next unit meeting, which we will be having convened next Thursday the 12th. At this meeting, I will be having open suggestions on what teaching topics can be approached and how they can be approached. I would like to first off gain your input as to how we can interweave more teaching into our unit.
Well, I guess the open discussion would be helpful to include everyone else's input. With regards to my circumstance, I would suggest teaching and discussing ways to introduce time management.
Okay, well, I'm glad you brought up the notion of teaching better time management skills, because this is another area that I did want to speak with you about. I see that you understand this is something that you need to work on yourself. What would you say are some ways in which you possibly waste the most time?
Honestly, probably getting started in the morning at the beginning of my shift. Sometimes it takes me a little bit of time to get moving when I first start my shift.
Okay, I see what you're saying. This is quite common with individuals of all types of work, so you're definitely not alone on this. I too have days in which I have trouble finding the motivation to get going. Personally, I have found that setting forth a daily routine helps me the most. By setting forth a routine, I can set aside times to which I can accomplish all of my tasks, instead of constantly trying to jump from this to that. Do you believe setting forth a routine could help you?
Yes, I really do. I do find myself jumbling multiple projects together, which is essentially why I didn't have my charting done on time, causing me to leave Mr. Smith unattended. I appreciate the advice and will definitely try to put this advice to practice.
Well, I appreciate your welcoming the advice. Like I had said before, your words are all fashionably in the right order. I just need your actions to take the same adjustments, which I fully believe will happen.
Yes, that they will.
Okay.
I feel bad in a sense to say that I am glad this happened, but a part of me knows that if it didn't happen, I would not have learned this lesson. I do not want this to happen any further of my patients. So I will definitely be more observant of all situations that I am presented with.
Okay, I agree. Occurrences like this do need to happen at times, and it's definitely a point of emphasis to learn from the situation to become a more competent nurse. Well, I thank you for your time, and I would like to end this meeting with telling you that even though this occurrence will be on your file, it does not define your future here.
Glad to hear that.
Okay. You will, though, be needing to attend a personal learning seminar that will be held in the near future, which you will need to keep an eye on for your email for.
Okay, I will be sure to keep an eye on an email for you.
Okay. Lastly, I will need you to write out your written transcription of the incident. I understand you are busy and do need to finish your assignments for the day, so I will allow you to either do this now or you can give it to me by the end of the day.
Okay, sir. I will get this to you by the end of the day.
Sounds good. Any other further questions or concerns?
No, actually, I do not believe so at this time.
Okay, well, if you think of anything, do not hesitate to ask.
I will surely keep that in mind.
Thank you for your time, and I will see you by the end of the day then.
Okay, I will drop off the written statement later today. Thank you very much.
Thank you for saying your name.
Thank you, sir.
I'll see you later.
Have a great day.
You too.